Welcome to Tala Talks NICU. I'm Dr. Tala, and let's go straight into reading neonatal abdominal X-rays. So let's start with a normal neonatal X-ray. So here you can see a normal bowel gas pattern. As you can see, there is gas distributed throughout the small and large bowel, and you can't really tell where the small bowel ends and the large bowel begins. They look very similar. Each loop is pushing into an adjacent loop, giving the overall picture of a mosaic appearance. You can see that none of the loops are super round or elongated. They all look kind of roughly the same size. Learn this really well before we go into what X-rays of neck and obstructions look like. And another normal KUB. By the way, KUB stands for kidney, urethra, and bladder, because traditionally in adults, that's what a KUB would mostly be used for. In neonates, we rarely diagnose anything urinary via KUB, but somehow we still use that term all the time over here in the US. So here again, you can see the normal bowel gas pattern, the mosaic-like pattern, so almost symmetrical polygonal gas spaces. So polygonal obviously just means shapes with loads of sides to them. None of the loops here are dilated or distended. We would consider a loop dilated or distended if the diameter of the loop was significantly larger than the transverse diameter of the vertebrae. The other thing that you should notice here is that the gas bubble is under the left dome of the diaphragm, and here obviously the liver is on the right. So obviously this gas bubble is the stomach. So I'll say this again, when we're reading X-rays, we read them as if the person is facing us, because they are. So this is the left and this is the right side of the body. So the left is where the stomach bubble usually is, and this is the right where the liver is. So what do you think is going on here? Everything is flipped over. Yup, this is Situs Inversus totalis, where all the left-sided organs are on the right and vice versa. So you can see the heart and the stomach are on this right side and the liver is on the left. Often we are surprised by this finding when we get the first X-ray in the NICU. It can be associated with other issues, so obviously this would be an important finding for this baby. This is something we see super often in the NICU, and this is the CPAP belly. This is basically where the entire belly is filled with extra air. Remember, when infants are on CPAP, it doesn't just blow into the lungs, it blows into the belly too. So the whole belly can get pretty distended. But again, you see that these loops, even though they're larger than the normal bowel loops on the normal X-ray, they're all still very symmetrical. There isn't one huge loop that's bigger than the others, and they're all still that similar polygonal shape, just making a much larger mosaic here. Right, let's start talking about neck. Let's imagine you have an X27-week infant who's now 4 weeks old, who presents with bloody stool and abdominal distension. Obviously, you want to get KUBs to look for signs of neck or necrotizing enterocolitis. And the next few X-rays will show the various stages of neck. This really confuses people, all of us, because the X-rays can look like something else is going on, or that the belly is just filled with stool. So it's important, obviously, to correlate all X-rays with a clinical picture. So here, these two infants do actually have neck, and you can tell just by looking at the X-rays that they don't look normal. They look very different from the normal bowel gas pattern we looked at earlier. So this one here on the left slide has these large dilated sausage-shaped loops. You can end up with loops like this whenever the gut is sick and peristalsis isn't moving the gas along. So you can see an X-ray like this if a baby is septic or has a UTI or really any causes for ileus. So the loops kind of get stuck just because they're not healthy, and so they get full with air. If you get several X-rays and these loops haven't moved along at all, this can be concerning for NET or even dead gut. This is called when you have a fixed loop. The X-ray on the right also has some non-specific patterns. You can tell it doesn't look normal. There are these weird pockets of gas all over the place and dilated loops over here which seem to be stacked on top of each other. There's a lot of grayness in the belly, so you can imagine that the loops themselves are really boggy or swollen. And then these weird pockets of gas here on the right side are really concerning for NEC. They look like they may not be inside a bowel loop, but maybe in the wall of the intestine. Now, look at this abdominal plane X-ray, which clearly shows pneumatosis. Pneumatosis intestinalis means that there is gas in the wall of the intestines. If you see it, the infant has NEC. So pneumatosis is pathognomonic for NEC. Pneumatosis can sometimes give a really bubbly appearance, which can, unfortunately, look just like stool and give this mottled type appearance. In this case, it looks a lot more concerning, like there really is gas in the walls up here. You could argue that the rest of the KUB actually does look more like stool. And then this one is like the classic X-ray you see of NEC, the very clear pneumatosis. Here, the gas doesn't look just like the bubbly appearance in the wall, but actually like a full strip of air. This gives the intestines the look of railroad tracks. Normally, it's not this obvious. You may see it in one small area of the KUB. Often, it's in the right lower quadrant where the distal ileum is, which is the most commonly affected area with NEC. So take a good look at this picture and just notice all these like railroad tracks all over the gut, which are very concerning for NEC. Now, these two X-rays are more advanced forms of NEC. The one on the left is clearly surgical. Surgical treatment is needed when the gut gets so sick that the wall of the intestine dies and there's now a hole in the wall. This allows air from inside the gut to get into the belly cavity or the peritoneal cavity. This is called free air. Here you can see this free air pretty much everywhere. You can also see the stacked loops and the mottled appearance consisted with pneumatosis. The one on the right doesn't clearly have free air, but you can see this pneumatosis, the bubbly appearance everywhere. And on both these X-rays, there is another finding also seen in advanced NEC, and that is this portal venous gas. You can see how you can follow the black pattern along the biliary tree inside the white liver. Always look for this sign on X-rays. It's really easy to miss unless you're really looking for it. So again, here you can trace out the biliary tree. So there's the portal venous gas again. This is another KUB with surgical NEC. So you can see all the stacked distended loops, the pneumatosis, and then all of this free air. Here, the free air is less obvious. You can make out a marking of what looks like a massive balloon over the abdomen. Free air can be difficult to see on a regular X-ray because, as you all know, air rises, and so it can basically be layering out on top of the bowels and it can be hidden. So if we have any concerns there may be free air, then it's helpful to get a KUB in a different position, or specifically the left lateral decubitus. This is where the infant lies on their left side, so left side down and right side up. The baby is looking at us in this direction. The liver is always this homogeneous white color, so we can take advantage of this, and if there is free air, then it will appear like a black rim above the liver, and it will be a lot more obvious, like you can see very clearly here. So if you're ever worried about free air, then get this X-ray, the left lateral decube. Okay, this is the last X-ray on NEC, I promise. This radiograph demonstrates a gasless abdomen, which is all just this grayish whitish color. Here, you can't see any pneumatosis or any loops or really anything. So even though there aren't any signs of free air or pneumoperitoneum, this can be a sign of dead gut, of a hidden or occult perforation and advancing peritonitis. Peritonitis means that there is literally an infection in the peritoneal cavity, which happens when the gut has perforated and all those bacteria from inside the intestines get into the belly cavity. So even though you can't see free air here, or really any air, this X-ray is very concerning. You definitely want to see some bowel gas pattern before feeding. Now let's move on to talking about more anatomical issues in the gut. A lot of the times we're concerned about an obstruction in the gut. So at some point in the tube from the stomach down to the anus, there is a narrowing or total blockage. Obviously, the more proximal the issue is, so the closer it is to the stomach and the throat, the less distended loops of gut you'll see. Newborns swallow air from the very first cry after birth. So gas is usually seen in the small bowel by about 3 hours, and it reaches the rectum by about 12 hours. So about 12 hours of life, you should be able to see gas throughout the abdominal X-ray. Let's start with this X-ray of an infant with a pyloric stenosis. By the way, babies aren't born with this, it usually develops over a couple of weeks, but I wanted to start with this one because it is super proximal. The narrowing is usually a thickening of the muscle of the sphincter, the pylorus at the lower end of the stomach. So with this narrowing, food can no longer pass, and these infants end up with projectile vomiting. Some air can get through, but still you see this large stomach bubble here. Clearly, it's not a complete obstruction because there is some air in the distal gas, as you can see from the loops further down. This is a very classic X-ray too, and I'm sure you've all seen one like it at some point. This is the double bubble sign. This is consistent with a duodenal atresia, or some sort of obstruction at the level of the duodenum, whether it's a volvulus or an annular pancreas or anything which causes a narrowing at that level. So here, the first bubble is the stomach bubble. Air then gets through into the proximal duodenum, and that's the second bubble, and then this gas can't get any further. In this X-ray, it looks like there's no gas distally, so this looks like it's a complete obstruction. And again, another KUB with a double bubble sign. Like we said, this is consistent with a duodenal atresia. So if you see this, put in a gavage tube to suction and get to a hospital with surgery. Now this obstruction of the gut is further down. You can't necessarily tell it's an ileal atresia, but that's what this ended up being. There is some sort of blockage, as you can see by a bunch of these large distended loops. Also, you can't see air in the rectum, or what looks like the distal colon. So this really does look like it's an obstruction. And this is another X-ray of an ileal atresia. You can see how incredibly distended these loops are. This infant desperately needs a gavage suction tube to suck some of that air out. If these get really bad, they can perforate. So again, this looks like some sort of distal obstruction, most likely at the level of the ileum. But really, without further evaluation or even direct visualization in surgery, you can't really tell what it is. So this could also be a meconium plug, where a bunch of meconium just gets stuck in the colon, causing an obstruction. Or it could be a Meconium ileus, which is the sticky meconium found in infants with cystic fibrosis. This could also represent a colonic atresia or Hirschsprung's disease, which we'll talk about in a second. Infants of diabetic mothers are also at increased risk of small left colon, where the descending colon is just much smaller than expected and can present with abdominal distension and constipation. And this is an X-ray of Hirschsprung disease. You can see the massive distended loops and really how similar it looks to the ileal atresia. Hirschsprung's happens when the nervous system of the gut doesn't develop normally, and some part of the colon, usually the distal colon, doesn't have any nerves in the muscle of the gut, so it can't perform peristalsis. It can't squeeze the meconium or the stool forward, so it all backs up into the area before where there are actually nerves. This is diagnosed with a biopsy of the rectum looking for these nerves. Hirschsprung's can be a short segment or it can involve the whole colon. It's difficult to tell how low the issue is from just an X-ray. Meconium peritonitis is also an X-ray finding that you'll definitely see if you work in the NICU long enough. And basically what you're looking for are these areas of calcification outside of the intestines within the peritoneum. This starts when a baby is still in utero, so some blockage like a Meconium ileus or an atresia causes buildup of the fluid and meconium and can sometimes cause perforation of the gut in utero. The meconium leaks out from the gut into the peritoneal cavity. It can cause a cyst or just irritate the whole area. Either way, this meconium calcifies within a day or two, and it will look like these bright white spots on the X-ray. So if you see these white calcifications like this on an X-ray, most likely there was a perforation in utero. and another X-ray showing Meconium peritonitis. This calcification is all over the place. You can also see the distended loops here, which look consistent with some sort of obstruction. This almost looks like wisps of smoke, so just be sure to look for this and take it super seriously if you see it. And lastly, here are 2 X-rays with infants with ascites. Ascites is when you have a bunch of fluid in the peritoneal cavity. This can be a part of hydrops where you have fluid in other places, or it could just be ascites where you just have fluid in the belly. Remember that if there is air in the bowel loops, then it will float to the top of the belly if the belly is filled with fluid. So imagine some kind of plastic floaties in a swimming pool. They'll float. And that's what happens in ascites. The center of the belly, when the baby is obviously lying down, is the highest point. So these bowel loops float up and they're in the center of the abdomen. In this case, this is urinary ascites, so urine is filling the belly cavity, which can occur if there is an anatomical issue with the genitourinary tract. So this is a very classic picture where all the bowel gas pattern is kind of centered in the middle of all this fluid all around it. This is another cause of ascites. Again, you can see all the bowel loops kind of congregating in the middle, and then this mass of gray fluid around the edges. We can't see the lungs or the heart in this one, so we can't really comment on whether this is pleural effusion or pericardial effusion, or whether it really is kind of part of hydrops or not. And that is it. Thank you so much for watching. I hope that gave you all a very good basis of how to read abdominal x-rays. If there's anything else that you would like to know specifically about this topic, then please let us know. In the meantime, if you learned something from this video and you liked it, then please hit the like button and subscribe if you're interested in neonatal content. If you do comment to us, which we can't tell you how much we love receiving, then please let us know where you're watching from. Thank you so much for being here.